Why does someone have balance issues, especially as they get older? It is mainly because of three systems that work hard to keep your balance upright. These three systems are the vision, the vestibular system, and the somatosensory system. In this video, I'm going to share with you a little bit more of each of these three systems and also some strategies that you can do to overcome any functional changes in each of these three systems. Welcome to Basically Physio. My name is Suresh and I'm a physiotherapist. The first system is the vision system. As we get older, a lot of medical conditions can cause changes to this vision system. One example is if you have diabetes, there will be some chronic changes that happen to your vision system. And this will lead to difficulties, especially in things like depth perception and contrast sensitivity. What this means is that in a crowded environment, if there are obstacles in the environment and one is closer to you and another is a little bit further away from you, when your depth perception is affected, then you may not be able to identify how near or how far away this object is, and this may lead to misidentifying of obstacles in the environment and leading to a fall potentially. And another contrast sensitivity is especially in low lit environments. You may not be able to suss out what are the objects that is in front of you, and especially if they are not brightly colored, then it's going to be quite difficult for you to identify where these obstacles are. So some strategies, the first thing you want to do is you want to go for your regular eye checkup, eye screening every year. Next thing is at home, make sure that your footpath is well lit, especially at night time. And you can use things like motion sensitivity lights, especially at night time. These are going to be very useful because as you walk, it lights up the area. But if you're not walking, then you'll just remain off. And the next thing is, for example, if you have steps at home, you may want to identify these obstacles and place bright colored tapes along these obstacles, especially in your steps. And this will allow you to actually understand where this object is in your surrounding, and you can actually use these bright colored tapes to actually overcome these obstacles and have a little bit more of a visual cue as you do the movement at home. And these are some strategies for your visual system. The next system is the vestibular system. This system consists of a vestibular apparatus in your inner ear which connects to the rest of your brain, and this is the central and peripheral vestibular system. And as you age, the sensitive hair cells within this apparatus may start to be a little bit degenerated and actually cause you persistent giddiness. And when you have this persistent giddiness or changes in position that causes you giddiness, then it is best that you check them out with a doctor and also a physiotherapist who has some training in vestibular rehab. Lastly, the somatosensory system. This system, what it does is actually get information about your body and where your joints are relative to where your body is. So this is called the joint position sense, and also the sensation and the proprioception for your various joints in your body. For example, a condition like diabetes or stroke or some spinal cord injury, these are the things that actually can cause changes to your somatosensory system. They may actually lead to some of these signals not coming back to your brain to process, and this will lead to a misrepresentation of where your joints are and also how sensitive or how much you feel your joints or your limbs after having any of this condition. So if these are affected, then it is going to significantly affect your balance also. And some of the tips that you can do to overcome or actually manage this somatosensory system impairments is things like balance training. I have a lot of videos on balance training, seated balance and standing balance. You can take a look at them to actually try out and see if it helps you. Another thing you can do is do a lot of barefoot walking and a lot of touching and using different textures to be placed on your hand on the affected area, and this will actually give you more opportunity to feel all these different textures, and hopefully there'll be some regaining of this sensation or proprioception that you have been affected for you. So these are some strategies if your somatosensory system is affected. And one more thing that you want to also do is try to do more weight bearing exercises, meaning you are standing or actually putting weight on your hand, using a body weight at least, so that it gives a little bit more of an input to your brain as you are going about in your daily activities. So these are the three systems. They are very crucial to maintaining your balance, and if any of this system is affected, then it's very likely that you will sustain a fall in time to come. So I hope that this video is of use for you, and do seek medical advice if any of this system is damaged for you. Thank you, and I'll see you in the next video.